Welcome to an AFSA presentation on food allergy and anaphylaxis. This presentation has been kindly sponsored by Texa from Pharmacodynamics. This presentation aims to give you a better understanding about food allergy and anaphylaxis. If you're living with a food allergy, you might wonder, why does my body react to certain foods while others can eat them without a problem? A food allergy happens when your immune system, which usually protects you from germs, mistakenly sees certain foods as harmful. When you eat even a small amount of the food you're allergic to, your immune system always reacts the same way, causing symptoms like itching, swelling, stomach pain, or even a severe reaction called anaphylaxis. Anaphylaxis is a serious, fast-moving allergic reaction that affects your whole body and can make it hard to breathe or cause a dangerous drop in blood pressure. This is serious, but with correct training you have enough time to recognize symptoms and remedy it by using your auto-injector. It's a medical emergency that requires immediate treatment with an epinephrine or adrenaline injector. Not everyone with food allergies will experience anaphylaxis, but it's important to know the signs and be prepared. Food allergies often run in families, so if a parent or sibling has allergies, you're more likely to have them too. Some people's immune systems are more sensitive to certain foods, seeing them as harmful when they're actually safe. This sensitivity is usually inherited, called atopy, which is why it may only affect certain people in your family. If you have a food allergy, you might also have, or develop other types of allergies. This can include asthma, trouble breathing due to airway sensitivity, allergic rhinitis, sneezing and runny nose from pollen or dust, or eczema, itchy skin rashes. These conditions are often linked by what doctors call the allergic march. Having one allergy doesn't mean you'll automatically get others, but it does make it more likely. This program will help you understand your food allergy and anaphylaxis, recognize symptoms, and know what to do in case of an allergic reaction. With the right information and support, you can feel more in control and live safely with your allergy. This program has two sections: Understanding food allergies and Understanding anaphylaxis. Welcome to the food allergy section. In this section, you'll learn about what food allergies are, how to recognize symptoms, and how to manage them. We will also explore how to avoid foods that trigger allergies, as well as strategies like milk, egg ladders, and food challenges. We have quite a bit to cover in this section, so let's get started with, what is a food allergy? A food allergy happens when your immune system mistakenly treats a specific food as a threat, even though it's harmless. Your body releases chemicals like histamine, causing symptoms ranging from itching to life-threatening reactions like anaphylaxis. Common allergens include peanuts, milk, and shellfish. Now let's look at food allergy versus food intolerance. People often confuse food allergies with intolerances, but they're different. Allergies involve your immune system and can cause serious life-threatening reactions like anaphylaxis, and appear within minutes or up to 2 hours after exposure. Intolerances cause digestive issues, are not immune-related, and are less severe and have delayed symptoms, for example lactose intolerance. Children with a true cow's milk allergy will not be able to tolerate lactose-free cow's milk products. It's not always necessary to avoid common allergens unless you're allergic. Cutting out foods unnecessarily can affect nutrition. In young infants, early introduction of allergenic foods can avoid food allergies. If unsure, consult a doctor who might suggest a food challenge to safely test for allergies. A positive skin or blood test does not always indicate an allergy. An allergy is a clinical reaction confirmed with a blood or skin test and/or a food challenge. Food allergy symptoms range from mild to severe. If severe symptoms like difficulty breathing or tight throat occur, it's an emergency called anaphylaxis. Use your epinephrine injector immediately and call 082911 or 10111. Always carry your adrenaline if you're at risk of severe reactions. You don't need a pen stored away in numerous places, but having 2 EpiPens on you at all times is critical. Ask about ingredients when dining out. Even trace amounts of an allergen can cause a reaction, so it's crucial to be aware of cross-contamination and hidden allergens in foods. Inform the teachers and principal at your child's preschool or school about your child's food allergies. Always be prepared. For example, have safe snacks with you when you are away from home. Avoiding food triggers means carefully reading food labels. The South African Early Grow app is a very useful tool to help you to ensure that you are fully aware of exactly what a product contains. In this way, you will be able to protect yourself against hidden allergens. Strictly avoid the food allergen. Discuss timely reintroduction with your allergy healthcare practitioner. For people with mild food allergies, food may be introduced at home. Only consider introducing food at home after it has been discussed with your healthcare practitioner. People with a history of severe reactions to food, those with asthma and children with FPIEs should not introduce food allergens at home. Egg and milk ladders are available for home-based reintroduction of food. Follow the ladder in a stepwise manner. Carefully observe for possible allergy reactions. If you experience any allergy symptoms, stop with the ladder immediately. How milk and egg ladders work. Both milk and egg ladders involve introducing tiny, gradually increasing amounts of the allergen under careful medical supervision. The process typically begins with highly processed forms of the allergen, where the allergenic proteins are broken down, and progresses to less processed forms as tolerance builds. For example, the milk ladder starts with baked milk, moving up to liquid milk. Always follow your doctor's advice when attempting these ladders to ensure safety. A food challenge is a test to see if you still have a food allergy, or to confirm a food allergy. Small amounts of the allergen are given in a controlled medical setting with experienced staff to ensure safety. This is not for everyone, especially if you've had severe reactions, unless under close supervision. It's not always necessary to avoid common allergens unless you're allergic. Cutting out foods unnecessarily can affect nutrition. In young infants, early introduction of allergenic foods can avoid food allergies. If unsure, consult a doctor, who might suggest a food challenge to safely test for allergies. A positive skin or blood test does not always indicate an allergy. An allergy is a clinical reaction confirmed with a blood or skin test and/or a food challenge. Food allergies are mostly outgrown during childhood. Remember to encourage children that they might someday also enjoy the food that they now have to avoid. To summarize, it's important to know which foods cause your allergies and take steps to avoid them. Always carry epinephrine and consult your doctor for updates on managing your allergy. Testing, like a food challenge, may help determine if you've outgrown an allergy. You have now completed all of the sections. Thank you for completing the section on food allergy. If you have any questions, reach out to your healthcare provider or visit www.allergyfoundation.co.za for more information. These resources are here to support you in managing your allergy safely. Welcome to the anaphylaxis section. In this section, you will learn what anaphylaxis is, how to recognize its symptoms, and how to respond quickly. We'll also show you how to use an epinephrine injector and handle emergencies when you're not with your primary caregiver, such as at school or with relatives. We will also look at the importance of the anaphylaxis action plan and how to talk to others about anaphylaxis. It is important to understand certain cofactors and unusual causes of anaphylaxis, and we will briefly cover this. Let's start with the first item. What is anaphylaxis? Anaphylaxis is a severe allergic reaction that can be life-threatening. It occurs when your immune system overreacts to something it sees as harmful. This causes symptoms like difficulty breathing and a drop in blood pressure. Common triggers include peanuts, shellfish, and bee stings. Let's look at the symptoms of anaphylaxis. Anaphylaxis symptoms vary but often include hives, swelling, especially on the face and throat, breathing difficulties, or digestive issues and nausea. Severe symptoms include dizziness or fainting. If these signs appear, act immediately to prevent complications. Anaphylaxis is a medical emergency. First, call emergency services. Use your adrenaline injector immediately. Stay calm and lie down to stabilize your blood pressure. If symptoms don't improve in 5 to 15 minutes, use a second dose if available. Don't wait, acting quickly can save your life. To use your EpiPen, start by removing the safety cap. Place it against the outer thigh, even through clothing if needed. Press firmly and hold for 3 to 5 seconds to deliver the medication. Remember, blue to the sky, orange to the thigh. Call emergency services if you haven't already, and monitor your symptoms closely. When away from your primary caregiver, ensure trusted adults, like teachers or babysitters, know how to use your epinephrine injector and recognize symptoms. Always carry your EpiPen and share your emergency plan with those responsible for your care. An anaphylaxis action plan is a plan that can be shared with your school, work, caregivers, and others, to ensure that everybody knows what to do in case of an emergency. This plan is available for download from the Allergy Foundation website www.allergyfoundation.co.za. Please download the plan as soon as possible. Always keep emergency numbers on hand. This may save your life. Talking about your allergies is important. Let others know your triggers, symptoms to watch for, and how to help during a reaction. Practice EpiPen use with family and friends, and ensure schools or daycare staff know your emergency plan and where your EpiPen is stored. Cofactors for anaphylaxis. There are certain factors that can aggravate an allergic reaction through different mechanisms. One must be aware of these factors and take it into account when you are having an allergic reaction. Increased absorption of allergens and enhanced immune reactions happen with exercise, fever, whilst menstruating, taking anti-inflammatory medication, and consuming alcohol. Unusual causes of anaphylaxis. This condition is when you can tolerate an allergen, most often wheat, but consumed 4 to 6 hours before exercise. As soon as your heart rate increases, you can have an anaphylaxis. The management is to simply not consume the offending food 4 to 6 hours before exercise. Red meat allergy is the one exception to the rule and happens 6 to 8 hours after consuming red meat. This can be confusing and may lead to a delay in diagnosis. To summarize, act quickly if anaphylaxis occurs, use your adrenaline and call emergency services immediately. Always carry your EpiPen, have a clear emergency plan, and ensure those around you know how to help in an emergency. Be aware of the cofactors and unusual causes of anaphylaxis. Well done! You have now completed all of the items. Thank you for joining us on this food allergy and anaphylaxis journey. We trust that this presentation has helped you to better understand your allergy, to recognize the symptoms, and to know what to do in case of an allergic reaction. Please join us for the free 2025 Allergy Education Workshops. This exciting new initiative includes a live question and answer workshop, where you can ask the allergy specialists questions. Please visit our website www.allergyfoundation.co.za for more information about your allergy and for the patient allergy workshop dates.